Eating disorders. This video is intended for parents just as an overview of what eating disorders are, signs and symptoms, and risk factors. There is a commonly held misconception that eating disorders are a lifestyle choice. Eating disorders are actually a serious and often fatal illness that are associated with severe disturbances in people's eating behaviors and related thoughts and emotions. Preoccupation with food, body weight, and shape may also signal an eating disorder. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia. People with anorexia may see themselves as overweight even when they're dangerously underweight. People with anorexia typically weigh themselves repeatedly, severely restrict the amount of food that they eat, often exercise excessively, and or may force themselves to vomit or use laxatives to lose weight. Anorexia has one of the highest mortality rates of any mental disorder. While many people with this disorder die from complications associated with starvation, others die of suicide. Symptoms include extremely restricted eating, extreme thinness or emaciation, a relentless pursuit of thinness and unwillingness to maintain a normal or healthy weight, an intense fear of gaining weight, distorted body image, a self-esteem that is heavily influenced by perceptions of body weight and shape, or a denial of the seriousness of low body weight. Other symptoms may develop over time. That includes the thinning of bones, mild anemia or muscle wasteness or weakness, brittle hair, brittle nails, dry or yellowish skin tone, growth of fine hair all over the body, severe constipation, low blood pressure, slowed breathing and pulse, damage to the structure and function of the heart, brain damage, multi-organ failure, drop in internal body temperature causing the person to feel cold all the time, infertility, or even feeling tired all the time. Bulimia nervosa. People with bulimia have recurrent and frequent episodes of eating unusually large amounts of food. People with bulimia have recurrent and frequent episodes of eating large amounts of food and feeling the lack of control over these episodes. This is binge eating, and it's usually followed by the behavior that compensates for the overeating, such as forced vomiting, excessive use of laxatives or diuretics, fasting, excessive exercise, or a combination of these behaviors. People with bulimia may be slightly underweight, normal weight, or even overweight. Symptoms include chronically inflamed or sore throat, swollen salivary glands in the neck and the jaw, worn tooth enamel, and increasingly sensitive and decaying teeth as a result of exposure to stomach acid, acid reflux disorder, or other gastrointestinal problems, intestinal distress and irritation from laxative abuse, severe dehydration from purging of fluids, electrolyte imbalance, which is too low or too high of sodium, calcium, potassium, or other minerals, which can lead to a stroke or heart attack. Binge eating disorder. People with binge eating disorder lose control over their eating. Unlike bulimia, periods of binge eating are not necessarily followed by purging or excessive exercise or fasting. As a result, people with binge eating disorders are often overweight or obese. Binge eating disorder is the most common eating disorder in the US. Symptoms include eating unusually large amounts of food in a specific amount of time, such as a 2-hour period. Eating even when you're full or not hungry. Eating fast during binging episodes. Eating until you're uncomfortably full. eating alone or in secret to avoid embarrassment, feeling distressed, ashamed, or guilty about your eating, and frequent dieting, possibly without weight loss. Risk factors. Eating disorders can affect people of all ages, race, ethnic backgrounds, body weights, and genders. Eating disorders frequently appear during the teen years or young adulthood, but may also develop during childhood or later in life. These disorders affect all genders, although rates among women are higher than those among men. Researchers are finding that eating disorders are caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. And they're constantly using the latest technology and science to better understand them. Treatments and therapies. It is important to seek treatment early for eating disorders. People with eating disorders are at higher risk for suicide and medical complications. People with eating disorders can often have other mental disorders, such as depression or anxiety, or even problems with substance use. Complete recovery is possible. Treatment plans are tailored to individual needs and may include one or more of the following: individual therapy, group therapy, family therapy, medical care and monitoring, nutritional counseling, and medications. Psychotherapies, such as family-based therapy called the Maudsley approach, where parents of adolescents with anorexia assume responsibility for feeding their child, appear to be very effective in helping people gain weight and improve their eating habits and moods. To reduce or eliminate binge eating and purging behaviors, people may undergo cognitive behavioral therapy, which is another type of psychotherapy that helps a person learn how to identify disordered or unhelpful thinking patterns and recognize and change inaccurate beliefs. Medications. Evidence also suggests that medications such as antidepressants, antipsychotic, or mood stabilizers may be helpful for treating eating disorders and other co-occurring illnesses such as anxiety or depression. If you or someone you know needs help with an eating disorder, or you just want to look for more resources, visit NEDA, the National Association of Eating Disorders website. That is nationaleatingdisorders.org. You can also call them at 1-800-931-2237 or text NEDA to 741-741. For more information about Mission West Virginia or our Healthy Relationships curriculum, visit missionwv.org or give us a call today.